My name is John Devera, and I will be talking about euthanasia. I am sure that everyone remembers the infamous Terry Schiavo case from 2005. This case was brought to the attention of the nation. In case you are unfamiliar with the case, Terry Schiavo was a woman who suffered from cardiac arrest in 1990. She was resuscitated, however, was left brain damaged from lack of oxygen and was comatose. For 2 years, doctors tried many types of therapy to bring her back to a coherent state. However, she was left in a vegetative state. Her husband filed in 1998 to have her feeding tube removed, and her parents fought him, stating that she was still conscious. Her husband stated that she would never have wanted to live the way she was living. After many years of battling, and the case even made it as far as President George W. Bush, eventually, her feeding tube was removed and died in 2005. This case sparked controversy everywhere. Everyone had their own opinion of the case, whether it be keeping her alive on a life-supporting feeding tube or letting her slowly die on her own without necessary life support. The lack of imminent death fueled much of the case. Schiavo was capable of surviving many years in her state she was in. The case had altogether 14 appeals and many motions, hearings and proceedings in the Florida courts. Her feeding tube was removed once in April of 2004. However, it was reinserted again several days later, until finally in 2005 it was permanently removed and Schiavo was finally able to die and have the peace she desired. It is easy to see how this became such a controversy. There are, of course, two sides to this whole case. On one hand, there is Schiavo's husband, Michael, who was fighting for her to be taken off life-prolonging measures. On the other hand, was Schiavo's parents, who fought to keep their daughter to be kept alive, saying that she was still conscious and deserved to stay alive. Of course, people believe that Michael had ulterior motives for Schiavo to die. He was still legally her husband, although it had been many years since Terry was her normal self. Michael had a girlfriend whom he wanted to marry and couldn't do that as long as Terry was alive. While no one knows the true intentions, the fact remains that Terry Schiavo was being kept alive in a vegetative state. Her husband claimed that she would never have wanted to be kept alive like this. Let's face it, who would? It had been many years since her brain damage, and chances of coming back to normal were very slim. Would you want to be kept alive, fed all your meals through a feeding tube, and not be able to adequately live? Probably not. Her parents, on the other hand, had their own motives for keeping her alive. That was their daughter. What parents would want to make the decision to end their own child's life? No matter what life the child was living, that is why there is such a huge controversy over euthanasia, because it is killing, no matter what way you look at it. Let's start by discussing exactly what euthanasia is. It is the suicide of a patient suffering from an incurable disease affected by taking of lethal drugs provided by a doctor for this purpose. So basically, it is someone with a terminally ill disease, probably suffering, and they make the decision to end their life. They know they are going to eventually die, so it is essentially speeding up the process in order to escape the suffering and pain they are going through. It is a natural decision that many would find themselves making if they are faced with these dire circumstances. There is actually two different types of cases: right to die and assisted suicide. Right to die involves removal of a feeding tube or life-supporting equipment, and assisted suicide is administering lethal medications. Why suffer when you don't have to? You don't know you are going to die from your illness. So make it easier on yourself and your loved ones who have burden and pain of watching you go through with it. However, the ability to make this decision is illegal in all but 5 states. This debate goes way farther back to before America was born. This is something that has been said to be around since before the birth of Christ. The Hippocratic Oath which is an oath that came about around 4th century BC. It states, "I will not give a lethal drug to anyone if I am asked, nor will I advise such a plan." This oath is not taken by doctors today. However, by this being in the oath from such a long time ago, you can see that it was something that was controversy even back then. The idea that makes illegal to perform such an act can be tied in with biblical commandment, "Thou shalt not kill." However, is it becoming more accepted in different religious groups? While it is still illegal, there are groups out there fighting for this to be legal. So this brings about the big question. Is it legal for people to make the decision to end their own life when faced with life-threatening conditions? In 1997, the United States Supreme Court made the ruling that Americans do not have the right to doctors-assisted suicides. But in 2006, the Supreme Court decided that such cases should be left up to the individual states to decide. In Oregon, an act was passed called the Death with Dignity Act. Washington State also passed an act modeled after called the Washington Statute Model. It sets certain requirements and safeguards in place for people wishing to make the decision to end their lives. First, the patient must be of a sound mind when they request lethal doses of medication to end their life. 2, doctors must confirm a diagnosis of terminal illness with less than 6 months to live. Also, 2 witnesses unrelated to the patient must be confirm the patient's request, and the patient must make a second request in 15 days. In conclusion, assisted suicide is something that is controversial everywhere. There is no clear right or wrong area. There is so much gray area. Is it legal? Is it ethical? Is it the right thing to do? No one really knows until faced with terminal illness. It is a decision that is not made lightly, and is something that affects not only the individual involved, but their families and loved ones as well. It has been a debate for a very long time, and is something that should be taken seriously by everyone. Thank you.